Yes, and I'm just looking on the website to where it talks about these regional restrictions and saying that people can gather only with their core bubble. And it says very specifically that that's the only group you can go to a restaurant with, but also mentions that other places like movie theaters and are still open. So people can still do, I guess, some of those other social things as long for themselves, as long as there is the ability to have physical distance. I'm just trying to kind of figure out where the line in the sand is there.
So what we're telling people, this is a short-term thing where we need to stop our social interactions with people outside of our close groups. Where we are not seeing transmission is where we have adequate COVID safety plans in place. So if I and my partner want to go to see a movie and we're sitting by ourselves, we have the spacing in place, we have the appropriate things in place, those are working. Same with restaurants. We have quite strict protocols in restaurants. And since we put those in, particularly since we put in the capping of serving of alcohol at 10 o'clock and the earlier closing, those were the time periods where we were starting to see creep, where people were, not obeying the rules and wanting to socialize together. Since we have those in place and when they are being followed, so that's on us as well as on the restaurants, that we're not seeing transmission. So we can still safely go with our close household, and it's the challenge is defining a household for people that live in many different situations. But the optimum is the bottom line is it's the small number of people that you have your own close contact with. Going back to that bubble that we defined earlier on in this pandemic.
Dr. Henriette, I'd like to get clarity on the restaurant situation. The head of the Restaurant Association is saying that people can go to restaurants with people outside of their family. Can you make it very clear for people who they are allowed to go to eat at a restaurant with in different circumstances?
Yeah. These are another one of the detail things. What we are asking people is that when you socialize with your household, whatever you define that to be, your pandemic bubble. So yes, you can go to a restaurant, and I encourage people to continue to go to our restaurants that have their appropriate safety plans in place. But right now, we need to make sure that we're doing it with our group of people. It's not up to the restaurant to police this. It's up to us to police this. And that means, keeping our group small. We know there's a limit at 6 people on a table. That is in place. Don't try and go with a larger group. Don't try and mingle with groups. Now's the time where we say we need to pull back from that. We need to support our restaurants, but doing it with our small group or going to takeout.
Richard, do you have a follow-up?
What sort of enforcement measures are going to be put in place? I know the language has been, this is about guidance, about people knowing the right thing to do. Can you speak to whether there's additional support for enforcement, how often we're going to see enforcement, and in what environments? I know you mentioned like the higher risk workplaces may see an increase in enforcement. Will we see changes in enforcement in places like restaurants or monitoring spin studios? Can you speak to that evolution?
Yeah, so what we have done is under both the Public Health Act emergency and the Emergency Programs Act, declaration of an emergency, allows us to have a broader set of people who are able to enforce orders. And some of them are orders. So yes, we have bylaw officers, we have police officers, public safety officers, we have some provincial inspectors, as well as our public health inspectors and WorkSafe BC inspectors, who are all able to enforce these orders. Depending on what they are. And yes, we will be having enhanced reviews and stepping up and enforcement if needed from public health and WorkSafe and bylaw officers for restaurants, for businesses. We want people and we need people to pay attention to these things, particularly now. We're seeing, we saw a couple of outbreaks recently, for example, in food processing plants. We know we had a whole blitz on food processing plants a few months ago because we had seen some quite large outbreaks, and now we're going back again. Some of these are higher risk workplaces where there's a lot of people together and by the nature of the work, and things slip over time. We get a little bit complacent, or people forget to check, or they don't think that they're sick anymore, or they don't pay attention to the fact that they're not feeling that well today. So we need to redouble our efforts, and particularly the focus is going to be in the Vancouver Coastal and Fraser Health region, because that's where we're seeing community spread at a higher level now. So more than ever, we need to go back to those plans that we had in place and make sure that we're doing all of them and following them meticulously.